Welcome, good morning. Thank you very much for coming. My name is John Sofis Scheft. I'm an attorney with the Bellotti Law Group in Cambridge. It's my honor and privilege to represent the Massachusetts Prevention Alliance. This is a coalition of public health officials, treatment specialists, physicians, nurses, counselors, teachers, police officers, public officials, parents and concerned citizens, and maybe most importantly, you see a lot of young people in this room. These are the people that are part of our coalition. It didn't exist 11 months back. It began in the living room of our president, Heidi Heilman. We started speaking at large and small gatherings, in high school auditoriums, and in cramped conference rooms. We put together a website, mavotenooonquestion3.com. We're still being outspent literally $1 million to one in a campaign for this law that's being fueled by an out-of-state insurance billionaire in Ohio. 3 months ago, independent polls showed that 70% of the likely voters in this state were in favor of question 3. Today, right now, I'm pleased to report that a Suffolk University WHDH-TV poll reports a statistical dead heat. We're tied, and we have 6 days left. Why the shift? The reason is what we've said all along. When voters get past the title and become aware of the actual components of question 3, they realize a yes vote will put in place a surefire public health and safety crisis in the Commonwealth. The voters are beginning to understand that this proposed law is not about giving those with grave illnesses access to marijuana. All of us in this room support compassionate care, and we're willing to talk about responsible ways to do that. But the system question 3 proposes goes way beyond what any responsible citizen wants. Here are just 3 reasons why informed Massachusetts citizens are changing their minds every single day. 1. Question 3 gives any physician the authority to issue a registration card to virtually anyone. How can that be? While the proposed law does mention diseases like cancer and ALS, it also covers, and I'm quoting, any other condition. The card you get from your doctor is good for life, with no restrictions on the amount you can purchase. There's even no minimum age for card holders. This loophole language is a Xerox copy of the laws now in place in California and Colorado. Less than 5% of the marijuana card holders in those states have what we would consider serious conditions that question 3 is supposedly all about. The other 96%, many have a history of addiction, and almost all have vague diagnoses like anxiety and chronic pain. Think about this. 1 in 36 people in Colorado now have a medical marijuana card. Colorado has approximately 5 million people, a population close to Massachusetts. This is previews of coming attractions if this law passes in our state. Number 2, question 3 mandates 35 marijuana shops around our state beginning in January of 2013. That's 2 months from now. In later years, the numbers will increase. Los Angeles started small too, but they have 1,000 pot stores in that city right now. The proposed law refers to, quote, marijuana treatment centers. That's a deliberate smokescreen. Read the law. There's no treatment in these centers. They are stores. They're not affiliated with any pharmacy or any healthcare organization. They don't even have to have a trained medical staff on site. If you want to own one, you don't even need to be a Massachusetts citizen under this proposed law. You only have to be 21 with no prior felony drug conviction. That's it. These dispensaries are going to sell marijuana and a host of spin-off products. They're all permitted under the language of the law. Things like candy and food with cute names and bright-colored wrappers, marijuana soft drinks, and something called tinctures, which is alcohol infused with marijuana. These are the items that kids gravitate to. And it's why in Colorado, we now know 74% of the youths that are addicted to marijuana got their supply from a medical marijuana card holder. They have been in these stores. This is how they get access to newer and more potent products and strains of marijuana. Everyone knows the expression, right? Build it and they will come. Look no further than Maine. Maine has only 8 marijuana stores, and they now serve 27,000 cardholders. With 35 stores in the first year alone in Massachusetts, we're going to quickly find 100,000 cardholders in our state. Colorado, same population, has approximately 116,000 cardholders and growing every day. It's why addiction rates among our youth have skyrocketed in other states that have passed medical marijuana laws. Number 3, as if 35 pot stores in the first year isn't enough, question 3 allows any cardholder who claims financial or transportation hardship to receive permission to grow their own supply at their home. There aren't any zoning restrictions proposed for this activity. And if that isn't enough, every cardholder under this law will be authorized to carry and transport in their vehicles an undefined 60-day supply of marijuana and smoke it at any non-public location except workplace, schools, and prisons. And they can smoke with anyone they want, including children. If the experience of other states is a guide, this will allow people to publicly possess and provide hundreds of joints at any one time. This is not spin. This is not our opinion. This is the language of the law. Read the 6 pages of the law. It's very, very clear. You know, there's so much more that's wrong and reckless about question 3. And it's why when we encounter voters who've made a snap judgment to support it, we make one simple request. Go to our website, vote-no-on-question-3.com. Take 3 minutes to review the videotape, question 3 in 3 minutes. Take a few minutes to read the reasons why this law is a bad idea for Massachusetts and why it's no mystery how this is going to turn out, because we have the examples of other states like California and Colorado who've gone before us and failed miserably. Even people who think medical marijuana might be a good approach under certain conditions, when they just look at the law, they always say to us, wow, not this law, not this way. I'm glad I now know Massachusetts is smarter than this. Now, we asked you here today to consider question 3 and understand why it's such bad policy for Massachusetts. But maybe more important, you're going to hear from real people who've been affected, really affected by the highly potent, shamelessly marketed marijuana that we find in states that have now embraced this option. At this point, I would like to bring up Lisa and Bill Brandon. They are parents of Connor Brandon, who died of an overdose at a concert at the Comcast Center last July. When he went out to attend college in San Diego with a pot shop on every corner, what had started as a little experimentation with marijuana turned into an addiction that took his life. Lisa, Bill.